Today we'll discuss about the most common problem where every parent is experiencing at some point of time from their kids, the hair loss problem. What are the reasons for the hair loss in kids? What are the ways we have to handle it? When it is the right time to meet a doctor? We will all discuss about these problems now. The most common problems usually in kids hair loss problems are tinea capitis, which is a fungal infection in the scalp, and other is an alopecia areata where they have a bald patches of hair loss, and otherwise there can be sometimes a trichotillomania or a traction alopecia, or sometimes a nutritional deficiency associated hair loss, or an endocrine problem associated hair loss, or sometimes following illness or some other major stress or something which is a telogen effluvium, which is another type of hair loss which is commonly seen in kids. But how do we differentiate all these types of hair loss? Do we really need to go to a doctor for all these hair loss problems? I'll explain you what symptoms or for which problem so that you can identify the earliest point which is the right time to meet a doctor. Tinea capitis is a fungal infection where it leads to itchy scalp, having flaky skin, along with that a hair loss in the patch. That hair loss patch usually has a grey color appearance or a black dotted appearance in the patch, and it can increase in number, it can spread to the other family members, and if neglected, leaving it for a long time can turn into a scarring type of alopecia. So definitely this needs an oral treatment along with the topical creams, and it is always advised to meet a doctor when you experience such sort of problems. The other problem is alopecia areata. Alopecia areata is a completely non-symptomatic or asymptomatic bald patches which can happen in your scalp or sometimes involve your eyebrows, eyelashes, or sometimes other body areas. Suppose if it is in a pubertal males, you can even see in the beard area where they don't find hair to grow back once it is shaved. What is the reason behind it? It is actually an autoimmune problem where your own body rejects your own hair for no reason. So it can be because of a family history sometimes, or sometimes kids can have atopic history, which means they can have a dust allergies or a family history of asthmas or atopic dermatitis, where it can be a part of the problem. Or sometimes this problem usually can recover by itself, but it is an issue of a panic for the parents and also for the child to take the hair loss patch. There are many chances for the hair to come back, but when it is progressing rapidly, when it is involving the face areas or the body areas, and it is taking more than normal time for it to recover, then definitely it's an alarming thing that you should meet a doctor to start sometimes an oral medication, or sometimes just give a topical lotions for the condition to improve. And usually this is a non-scarring alopecia where the reversal or regrowth of the hair is definitely possible, and it will look completely normal once the regrowth happens. Coming to the other type of alopecias, which is traction alopecia. This is actually because of the hairstyling habits, either from the aspect of the mother who takes care of the hair, or the kids who are doing more of different hairstylings, which is more attraction which is put on the hair when they are tying their ponies or doing some different styles of hairs, which leads to pull on the head, leading to hair loss. This is completely asymptomatic, and you can see in this the hairline grows slowly backwards, and it is completely non-associated with pain or bald patches. But this only needs just a change in your hairstyle pattern which will reverse all your problem. But persisting traction can lead to permanent hair loss, but at an early identification of this problem and changing of your patterning of hairstyling will reverse your hair loss. Coming to the other type of hair losses, which is a nutritional deficiency associated. Definitely vitamin deficiencies like vitamin D, B12, iron, zinc, biotin can lead to hair loss. So definitely nutrition should be in a complete pattern, and it should be involving all proteins, vitamins and minerals. Definitely good protein diet helps to improve your hair growth. Telogen effluvium is another more common problem which is seen often in kids following any major illness like fevers which was lasting for a long time, or following some surgeries for any other reasons if they had got it done, or stress associated hair loss. These all can lead to the hair loss problems which is called telogen effluvium. This is a temporary phenomena where proper nutrition and hair serum application can reverse your hair loss, and it is recoverable. But persisting loss of hair for more than 6 months definitely needs to further evaluation of the kid, so that if any other causes we are missing in terms of hair loss. Coming to the hormonal issues leading to the hair loss, it is a thyroid issue which is one of the most common, where hypothyroidism can lead to a hair loss, and sometimes a hormonal imbalances or polycystic ovarian syndrome or acanthosis nigricans is another marker of the skin which is indicating that the child is gaining weight, and you need to check for your PCOS if they are in pubertal age group. So these are the common hormonal issues which leads to the hair loss. If it is not responding to routine treatment, doctor usually thinks in other lines for further evaluation and management. Last but not the least is trichotillomania, where the kid has an compulsive pulling habit of their hair, particularly in few places, most common in the dominant hand side. When they are involved in doing some work or when they are sitting idle, they just hand goes into the scalp and they put constant traction on the hair and pull it off from the scalp. This leads to broken edges of the hair, where you see patches of hair with is in different lengths, sometimes complete loss of hair depending on amount of traction they put. This is an absolute behavior problem where parents need to identify it, and a proper counseling and help of the therapist will help them to come out of the problem and overcome the problem. So what are the treatment options we have for these hair losses for the kids? Depending on the type of the problem, first the proper reason for the hair loss has to be evaluated, and the treatment should be directed towards that particular problem. Like how we have discussed, in terms of tinea capitis, it is mostly the antifungal treatment which plays a major role. You need to give an antifungal oral therapy which needs for 6 to 8 weeks till the scalp gets cleared of it. The scaling would stop, and even this problem can be confirmed by taking the hair pluckings under the microscope, where you can find the branching fungal elements by using the scales or by using the hair. And you also need to use topical lotions and shampoos so that the spread to the other kids would definitely be contained rapidly. The other one was alopecia areata, where we need mild topical steroid lotions and also oral supplements along with minoxidil and other lotions. If it is extensive, an oral immunomodulatory therapy might be advised depending on the grade and severity. And the nutrition type of hair loss is usually advised in terms to improve your nutrition, which involves having eggs, milk, nuts, and even lentils, meat. If you are a non-vegetarian, definitely it would help. These all or should be made a routine part of your diet, and particularly to improve your iron deficiency, you need to concentrate on having more of seeds like flax seeds, till, jaggery, and also spinach, which have good amount of iron content, and also few pumpkin seeds can be added in the diet. So these dietary changes is definitely advised to improve your hair care. And further evaluation in terms of thyroid, if it is present, they should also have thyroid supplementation along with the treatment for their hair loss. So these are the medical line of management, and many a times parents do come up with multiple sort of doubts, like how frequently they should wash the scalp of the hair of the kids, what oil they should use, and what all changes the home remedies they need to try for their kids. Definitely oil has no role either to stop your hair fall or to increase the length of the hair or any other aspect, but it is definitely helpful in terms of making the hair soft, not to become brittle, and also to improve the texture of your hair, to decrease the frizziness, and it is our traditional age-old conditioner for the scalp and also the hair. But if your kid is having lot of dandruff, definitely it is advisable to decrease the frequency and the quantity of the oil you apply. Instead of using overnight application of oil, it is advisable to apply oil just before your head bath, like 1 to 2 hours before your head bath is advisable. And any type of oil, whether it's an almond, olive or coconut, it doesn't matter. All the types of oils have been studied and no advantage has been proven one above the other. So any type of oil can be chosen depending upon your requirements. Coming to the frequency of washing your scalp, you need to wash it minimum weekly twice, and if it is more oily type of a scalp or having a dandruff, an additional component in the shampoo should be checked, like zinc pyrithrone or ketoconazole, which will help to decrease your problem of dandruff and also prevent the itchiness of the scalp. So these are the conditions which definitely be checked. And using conditioners in kids, irrespective of the age, conditioner can be used, and it is usually advised for the hair length than the scalp. This helps to prevent the damage of the hair either from the external agents or to maintain the cuticle of the softness of the hair, and also to prevent the damage which was caused by excessive shampooing, or those things can be avoided by using conditioners. So by using these home care tips and also the ways of scalping, oiling of your scalp and all these things, definitely you can take care of your hair and skin healthy.